Tonight's big story, funding for independent rural hospitals. At this time, several in the state line say they are struggling.
And two of those are right here in our area, KSB Hospital in Dixon and FHN in Freeport. Both of these hospitals are independently owned, leaving them to operate differently than some of our larger providers such as OSF, Mercy Health, or UW Health. Both KSB and FHN are also the only hospitals in their respective counties of Lee and Stevenson, leaving them to care for a large area. With both KSB and FHN being the only hospital in those areas, tonight we're digging deeper into the matter, looking at how far people would have to travel for medical care if the hospitals were forced to close.
And when taking a look at FHN, the closest communities that offer hospitals are in Monroe and Rockford. Monroe is about 22 miles away from the Freeport community, with the second closest will be here in Rockford, with Freeport being about 28 miles away. When it comes to Dixon, there are three communities that offer hospitals: Rochelle, Oregon, and Sterling. Sterling, not too far away, Oregon being about 15 miles away, and Rochelle 23 miles away from the city of Dixon. And due to the funding challenges, KSB Hospital is currently looking for partnerships to help make ends meet in the future. However, FHN is making their limited resources work via other avenues.
13 WREX's Emily McMinn checked in with these hospitals who share more on the challenges and potential solutions. Emily, this is an issue for many rural communities, right?
Yes, that is right. Although the funding challenges are hitting close to home, both hospitals say these issues exist across the country, leaving them with the burden of finding other ways to best serve their community members.
Just makes it extremely difficult to be able to reinvest into property, into people, equipment, and, more importantly, the programs that we want to be able to provide for our community.
The lack of resources has led FHN Hospital to have to use their funding efficiently and look towards other options, as they say they're not quite at the point where a partnership is needed, but community care remains the highest priority.
To reach out for collaborative relationships. So we're happy to work with a number of large systems, and in fact, it's helped to provide better care to our community.
Over his 45-year career at KSB Hospital, the Director of Business Development, Kevin Marks, says there have certainly been shifts.
Changes in the way Medicare reimburses for services, the way customers access services, and then the pandemic was obviously a major impact for healthcare across the board.
And despite them reaching out for help now, the issue remains far from new for the Lee County facility.
It's been a building situation, if you would. The last, reimbursement, financial pressures, if you would, financial headwinds have essentially been in place with our industry for, probably the last decade.
With almost 15 years under his belt working for FHN, President Mark Gridley realizes the problems are sticking around, leading them to focus on what they can control for now.
We have to really define what's essential services for a rural community. And there's a lot of things that we just have to provide because we're the only ones around.
At this time, KSB Hospital says they are still determining exactly who they plan to work with and the logistics of their new potential partnership. Back over to you, Brittany and Derek.